Mrs. Shirley Stumblas. I also want to recognize the World Health Council represented here in Zambia, Dr. Nathan Bachaita. I also want to recognize the Global TB Director in the World Health Organization, Geneva, Dr. Teresa Kasaeva, who is joining us virtually. We would like to appreciate this gesture to have Dr. Kasaeva, but also would like to the permanent secretary is present, but also all civil society organizations and also community organizations, but also the senior directors in the Ministry of Health and all staff at the Ministry of Health. We are not forgetting the front line workers who are actually following us, and also the members of the place, and ladies and gentlemen. Our first speaker today, we are going to hear a speech from the representative of the U.S. government, Miss Shirley Stumblas. Sorry. I play. So what? Who can say? So you let me know. I've just been advised that I think we just delay a little bit to call the first speaker. So I'll be advised when the first speaker has to speak. Just to say that this is a big day for us here in Zambia. As you know that the World TB preparations activities started with the Land for TB that we conducted last Saturday. But also you are aware that the Honorable Minister of Health yesterday also launched the countrywide active case finding in Kitwe on the Copper Belt. It was also a big occasion, raising awareness, but also making sure that we have renewed energy efforts to find the TB cases. As I said, we're going to wait for the signal for us to call for the first speaker. And this is why I'm just highlighting some of the issues that we have been conducting leading to this day. Judy. So who's going to give us it? Go ahead. Okay. So keep on waiting. Definitely, we are going to move with the program. Check. We can start. Start. Thank you so much once again for waiting. Now we proceed with the program. And as I said earlier, this time we'll hear a speech from the representative of the US government that will be said by Mrs. Shelley Stumblers. Please, the stage is yours.
Thank you. Honorable Minister of Health, Mrs. Sylvia Musebo. Ministry of Health Permanent Secretary, Professor Luxin Kasonka. Ministry of Health National TB Program Manager, Dr. Patrick Lungu. WHO Country Representative, Dr. Nathan Bakaita. WHO Global TB Director, Dr. Teresa Casiva. Health professionals across the country, cooperating partners present, esteemed guests, good morning. It is my pleasure to join you today as we celebrate World Tuberculosis Day with this year's theme, Invest to End TB, Save Lives. Under the leadership of the government of the Republic of Zambia, and in collaboration with our other partners, the United States is committed to combating and ultimately eliminating TB in Zambia. 3 years ago, in response to the United Nations General Assembly's high-level meeting on TB, USAID announced the beginning of the Global Accelerator to End TB by 2030. This initiative adds to other US government resources, notably the PEPFAR's Emergency Plan for AIDS Relief, or PEPFAR, which works in Zambia to fight the dual TB-HIV epidemic. We aim to end TB by training healthcare workers at the community, district, and national levels, utilizing high-impact programs for case detection and treatment, supporting community outreach, purchasing TB medications and supplies, providing technical assistance to the Ministry of Health, and supporting facilities to test TB samples. Initiatives like these help people like Bridget Sakani. Bridget lives in Nakonde district and is one of many TB patients in her community who walk long distances to reach health facilities for services. This long commute is a major deterrent to seeking a diagnosis or staying on treatment. Through the support provided by the US government, 10 community volunteers in Bridget's community were recently trained to support TB patients in her area. These volunteers help with medicine collection and escort patients to the clinics for follow-up and referrals. Thanks to these volunteers supported through USAID, Bridget and almost 400 other TB patients all successfully completed treatment in 2021, a 100% treatment rate. And I know this audience is well aware, but it's still so important to highlight. We know that completing treatment not only cures patients, it helps prevent the development of resistant TB strains, two essential elements for us to limit TB. It is clear to us that this work at the community level is making a difference in places like Nakonde and across Zambia. The US government also supported the National TB Program to conduct a study to better understand the causes of TB-related deaths. This study showcased that patients often don't go to health facilities until it is too late, and healthcare workers delay in diagnosing TB. We have adjusted our programs to address these findings. We have intensified training and mentorship of healthcare workers and deepened community sensitization initiatives. Together with the Ministry of Health, we are encouraged by Zambia's continued progress in reducing TB illness and deaths in communities where our partnerships are active. In recognition of Zambia's progress, I am very proud to share that the Zambia government's TB team was recently selected as a 2022 TB champion team as part of the Centers for Disease Control and Prevention's annual global competition. In fact, For those of you that are in the conference facility right now, you will see our acting CDC director presenting this award to Dr. Lungu and the Zambian team. The fact that the Zambian team's tremendous work and commitment to eliminate TB was recognized on a global stage is evidence of their expertise and commitment. And I hope you will all join me in giving them a virtual round of applause from wherever you are joining us today. In 2020, thank you. In 2021, through USAID-led partnerships, over 51,800 Zambians were diagnosed and initiated on TB treatment. In addition, over 400,000 people accessed TB preventive therapy, and approximately 9 out of 10 who started TB treatment completed it successfully. However, challenges persist. First, childhood TB notification remains low at only 7% of the total notified cases. To eliminate TB, we need to increase that percentage to 10 to 15%. Second, drug-resistant TB detection continues to decline. In 2020, we only found and put 494 Zambians on treatment. However, our target was 722 Zambians. Finally, we also know that the ongoing COVID-19 pandemic continues to present challenges. In the past 2 years, fewer people have visited clinics due to the pandemic. Moreover, health resources, including healthcare professionals and lab equipment, have been diverted to support the COVID response. This places a strain on those same resources to respond to TB. As a consequence, we are struggling to diagnose and treat enough Zambians to remain on track to eliminate TB by 2030. But despite these challenges, the talented, tireless, dedicated health professionals in Zambia press forward. The government of the Republic of Zambia, the United States government, and our partners are using innovations such as remote progress monitoring, multi-month dispensing of HIV and TB drugs, alternative drug pickup points, and phone and SMS patient follow-up methods to make it possible for patients infected with TB to access care and adhere to treatment while limiting their COVID exposure. We must continue to craft solutions and further tailor our interventions to prevent any unnecessary deaths from a disease that is 100% curable. Let me close by thanking all the health professionals with us today. The last 2 years have been relentless, but you have continued to put the health of the citizens of Zambia and the world at the forefront. Every global citizen is indebted to you. Lastly, I urge us all to continue to collaborate and take the necessary actions so that we together can invest and save more patients like Bridget Sakani and ultimately end TB in Zambia. Thank you for letting me join you today.
Yeah, so thank you so much for that wonderful speech. And as you rightly stated, now is a time that Zambia now receive the certificate for doing the best in providing TB preventive therapy. Over to you.
Thank you so much. So from the U.S. Centers for Disease Control and Prevention, I'm Janessa Georgie. I'm the current acting CDC Zambia country director, and I would like to present to the Zambia TB Situation Room team, our World TB 2022 Global TB Elimination Champion. So of all the countries, Zambia is one of 5 that was identified as a TB Global Champion. And I'm honored to be able to announce so the team, Dr. Patrick Lungu, Judith Masisi, Emmanuel Capasso Musata, Rina Chimizi, Clara Capasso, Morton Kaumba, Salani Namimbi, and Muhammad Muputu, and all the team that represents them. The citation says for being named Global TB Elimination Champions because of your significant contribution to eliminating TB and working tirelessly to adapt services and exceed targets amidst the COVID-19 pandemic, and an outstanding commitment to the contribution of TB HIV program under the PEPFAR Zambia program. We are honored to be collaborating with the TB Zambia team, and particularly the adaptions that the TB Situation Room team did. Congratulations from CDC to the Team Zambia.
Thank you so much. I think we need to clap hands, particularly front line workers and the community, because this work is done by them. Thank you so much. This time now, I call the World Health Organization country representative to Zambia, Dr. Nathan Bechaita, to give his speech. Thank you.
Thank you so much, Director of Ceremonies. The Honorable Minister of Health, Ms. Sylvia Masebo, MP. The Permanent Secretary of Technical Services, Professor Lakson Kasonka. The WHO Global TB Program Director, Dr. Teresa Kasayeva. United States government representatives and also Mission Director, Michelle Stumbras. The National HIV/AIDS STI/TB Council Director General, Dr. Connie Osborne. Cooperating partners present, directors from the Ministry of Health, the Program Manager, Dr. Patrick Lungu, civil society representatives, TB survivors present, distinguished ladies and gentlemen, and the press, good morning. We meet once again to commemorate the 2022 World TB Day. This year's theme, Invest to End TB, Save Lives, conveys the urgent need for the government and all stakeholders to increase investment of resources into the fight against TB to ensure achievement of the global commitments to end TB by 2030. Indeed, Zambia has already made significant strides to achieve some key milestones in the fight against TB. We therefore wish to congratulate the government of the Republic of Zambia for the outstanding achievement in reducing TB incidence rate and mortality rate by 18% and 30% respectively between 2015 and 2020. This is a success story of excellent multi-sectoral approach in the TB response. Honorable Minister, ladies and gentlemen, even though Zambia is one of the best examples of countries that have steadily increased domestic funding for TB by 7-fold since 2015, we still have more work to do to ensure that more lives are saved and we fully achieve the following commitments. Number one, the End TB Strategy 2030 targets call us to reduce TB incidence by 80% and reduction of TB deaths by 90%. The UN high-level meeting on TB treatment targets talks about treating people with drug-sensitive and drug-resistant TB, including children. Third, the UN high-level meeting on TB preventive treatment targets are to provide treatment to those most at risk of falling ill, so that at least over 350,000 people in Zambia, including 46,100 children, are protected. And the fourth one is the UN high-level meeting on TB funding targets, which calls us to mobilize sufficient and sustainable financing for universal access to TB prevention, diagnosis, treatment, and care, as well as TB research. Achieving these targets demands for government stewardship and accountability with monitoring and evaluation. Furthermore, there is a need for stronger coalition with civil society organizations and communities. We therefore need to finalize and disseminate the multi-sectoral accountability framework so that we ensure concerted action by all sectors to provide the right services, support, and enable safe environments. Everyone has a role to play in ending TB, that is individuals, communities, businesses, governments, and societies. Therefore, let's invest our time and energy to spark increased investments to end TB and save lives. I reaffirm the commitment of WHO Zambia and indeed the entire UN family to work with the government and cooperating partners and communities to support the above actions. May God bless you all, and God bless our beloved Zambia. Thank you very much.
Thank you so much, our WHO representative here in Zambia. And we're moving on to the next speaker. And I would like to say this, that guest of honor, our Honorable Minister of Health, this will be the first time, maybe I may be wrong, that during this important day, we are being joined by the World Health Organization Director responsible for global TB. And we take this with appreciation for her to join us. So this time, I'm calling Dr. Teresa Kasaeva to give her remarks. Thank you.
Thank you very much, colleagues. Hope you can hear me. And Your Excellency, Minister, honorable colleagues and partners, it's a real pleasure and honor to join you today and share warm greetings on behalf of the World Health Organization Global Tuberculosis Program. Hope next time I will be able to join you in person. It's a really great pleasure. As we come together to commemorate World TB Day, we stand in solidarity with the millions of people who fall ill with TB each year, and remember the millions who have lost their lives from this preventable and curable disease. The ongoing COVID-19 pandemic, coupled with the conflicts across Europe, Africa, in the Middle East, and has placed an even heavier burden on those affected, leading to disruption of essential TB services and additional death. TB remains one of the world's deadliest infectious killers. Each day, over 4,000 people lose their lives to TB, and close to 30,000 people fall ill with this preventable and curable disease. Global efforts to combat TB have saved an estimated 66 million lives since year 2000. However, the COVID-19 pandemic has reversed years of efforts and progress made in the fight to end TB. For the first time in over a decade, TB death increased in 2020. I would like to acknowledge great efforts over the past years and achievements of Zambia that allowed to decrease significantly TB incidence and TB mortality, while the treatment coverage increased impressively. I would like to acknowledge separately increase in access to the drug-resistant TB diagnostics and treatment, with expansion of the diagnostics networks using WHO-recommended molecular diagnostic tests. The collaboration across different programs and with different partners has been instrumental in the success to date. But despite of demonstrated by Zambia resilience of the health system during COVID-19 pandemic, which allowed to mitigate negative impact and avoid significant drops in TB notification, still a lot should be done towards reaching our NTB targets. And that's why focus should not be lost and will not be lost, I believe, and investments in TB programs should be increased, as highlighted in the theme of our World TB Day. As it's shown in the recent analysis in the Lancet, investments towards ending TB can lead to avoiding up to 24 million tuberculosis deaths and $13 trillion in economic losses by 2030. So it shows that investments in TB have multiple benefits, not only for the TB programs, but also for the preparedness strengthening and for the response to the ongoing and new potential threats. On World TB Day, WHO is calling for action on several fronts to ramp up investments and ensure that commitments made to end TB are achieved. First, we would like to call for an increase in domestic and international investments to close funding gaps for TB implementation and research. Countries are urged to increase domestic investments. However, international support is absolutely critical and should be also increased and will be required in the short and medium term. We need international donors to significantly increase and look at different sources, maybe new sources, new financial mechanisms to chart the way forward to a comprehensive recovery and further progress. Second, we should not forget that the progress in public health depends on innovation. Financing for TB research needs to more than double to drive discovery of new tools, including vaccines, and scale up life-saving innovations. WHO is intensifying efforts to shape the TB vaccines agenda with a high-level push this year through a global summit. Third, investments go beyond financing. We need to continue invest in sustaining essential TB services during pandemic and ongoing conflicts and any other issues to ensure that gains made in the fight against TB are not reversed. TB needs to be included into the pandemic preparedness plans in countries. Fourth, we need to invest in accelerating the uptake of new WHO guidelines and tools, including all oral treatment, rapid molecular tests that can significantly improve access, quality of care, and treatment outcomes for those affected. Fifth, poverty, inequity, undernutrition, comorbidities, stigma, and discrimination are major drivers of the TB epidemic. We need to invest in the extending social protection and universal health coverage, combating stigma and discrimination, as well as strengthening multi-sectoral engagement and accountability. We need concerted actions and greater accountability by all sectors to provide right services and enabling safe environment in the right place, the right time for people with TB. All these investments and actions can help drive the TB response to save lives and reach global targets. This will be critical, especially as we prepare for the second UN high-level meeting on TB in 2023 that will bring together heads of states and other leaders to re-energize commitment to end TB and review and report on progress achieved to date. As WHO, we commit to invest in leading the TB response and keeping the promises made to the millions affected each year. Despite any hardships, challenges, or crises that come our way, we cannot falter in our commitments till we reach and save every person, family, community impacted by this deadly disease. We call on you to join us in making investments of your time, energy, support, care, or financing towards ending TB. We can be a beacon of hope. Everyone, as my colleague, the Honorable WR Zambia told, everyone has a role to play in ending TB. I urge you to continue to work closely together to be the pathfinder and model for other countries, regions, and the world in accelerating the TB response, reaching targets and saving lives. Invest to end TB, save lives. Thank you.
Opportunity also support to our fight against TB. Indeed, we thank you, Dr. Teresa Kasaeva, for joining us. Ladies and gentlemen, we are getting closer to the time that we have been waiting for. This time I'll call the Permanent Secretary responsible for technical services in the Ministry of Health, Professor Lakson Kasonka, to ask the Honorable Minister to give her speech. Over to you, Prof.
Thank you very much. The Honorable Minister of Health, the UN family, representative of many other organizations, Minister of Health. Tuberculosis is such a huge government and public health concern. The leadership of the new government places a high premium on all efforts aimed at eradicating TB towards the year 2030. And on this score, the ministry recognizes all the efforts and roles played by various cooperating partners on this fight. And at this juncture, it's my distinct honor and pleasure to request the Minister of Health, Honorable Sylvia T. Masebo, MP, to give a ministerial statement on this very important day when we commemorate the World TB Day. Honorable Minister, Madam.
Thank you very much, Permanent Secretary. The Director of Global TB Program, WHO Geneva, Dr. Teresa Casaver, the WHO Country Representative, Dr. Nathan Bachiata, the United States Aid for International Development, USAID Zambia Mission Director, Ms. Shelley Stavros, Center for Disease Country Director, directors from the Ministry of Health present, the provincial health directors, district health directors, chiefs of party from all our cooperating partners, senior government officials present, civil society organization representatives present, community-based organizations representatives present, our frontline workers present, members of the press, distinguished invited guests. It gives me great pleasure to join you and the rest of the world today in commemorating the World TB Day. This is a day when we renew our commitment to raising awareness on a disease that continues to pose a threat to public health in the world, and Zambia inclusive. This year's World TB Day theme is Invest to End TB, Save Lives. This theme relates so well with the New Dawn's government agenda that has placed premium on improving the health of all Zambians. Ladies and gentlemen, Zambia remains one of the high TB burden countries in the world, with a TB incidence rate of 319 out of 100,000 in the year 2021. This rate translates to at least 59,000 new TB cases every year. Of paramount concern is that every year in Zambia, we lose not less than 4,000 lives arising from TB alone. We are aware that at the center of the high burden of TB disease and mortality are the gaps in awareness levels, misconceptions about TB, and that we still miss a significant number of TB patients. We can therefore say that TB deaths are heavily linked to lack of awareness. It is for this reason that we highly need to raise the desired awareness. By so doing, we will be saving multitude of lives. The majority of the TB deaths that we record are among patients with very advanced TB disease. which at the point of diagnosis, we are left with little time to place life-saving interventions. Ladies and gentlemen, the Ministry of Health, under my leadership, is determined to close the gap on the missed cases of TB, which is currently about 10,000. With this resolve, we continue to strengthen the TB diagnostic network and capacity of our frontline healthcare workers to recognize a case of TB and initiate appropriate TB treatment. Ladies and gentlemen, in spite of the high TB burden and the disruptions in the health sector brought by the COVID-19, we have made tremendous progress in our quest to end TB. In the last 2 decades, we have reduced the burden of TB by 58%, from an incidence of 759 per 100,000 in the year 2000 to 319 per 100,000 population in 2020. I also wish to share that from 2020 to date, we have accelerated our efforts in TB case finding. Our performance in 2021 is the best in the last 2 decades. I'm also reliably informed that our performance in 2022 will actually be higher than that of 2021. When we compare the first 10 weeks of these 2 years, we note that we continue to perform better than 2021. This is important to note because in 2021, we made a record and impressive performance by notifying 50,717 TB patients, countrymen and women. We need to build on this momentum. Not only have we increased TB case detection, but we have also improved and sustained a high TB treatment success rate for both drug-susceptible TB and drug-resistant TB, currently standing at 90% and 78% respectively. These successes are indicative of high-quality service provision with regard to TB, both in the health facilities and the community. Further, we have exponentially increased TB preventive therapy initiation, getting closer to saturation. These achievements are arising from the country's rapid adoption of the World Health Organization normative guidance, which includes scaling up of the recommended rapid TB diagnostics such as Gene Expert. We have also adopted and rolled out child-friendly treatment formulations and all oral drug-resistant treatment regimes. Ladies and gentlemen, our focus going forward is health system strengthening, thereby forming a firm foundation for quality health service provision. We will continue to encourage the integration of programs, especially with HIV, COVID-19, maternal and child, and non-communicable diseases. This approach will bring leveraging of resources and enhance efficiencies. Ladies and gentlemen, the new Dawn government, under the leadership of His Excellency, President Hakainde Hichilema, is committed to ensuring that we achieve the End TB strategy milestones and targets. The increased budget allocation to health sector, which will also support the recruitment of 11,200 health workers this year, is a demonstration of the new Dawn government's commitment to providing quality health services to all Zambians. Ladies and gentlemen, in line with this year's theme, to comprehensively respond to the current burden of TB, we will be investing more efforts and resources in the following areas. We'll be expanding diagnostic network to bring about equity and efficiency. We'll also be increasing human resources for health. We are also developing effective data management for decision-making and action. We will be empowering communities to actively participate in the fight against TB in line with the principle of decentralization policy. We will also involve the private sector in the fight against TB. Ladies and gentlemen, we will equally be joining hands with other sectors and arms of the government so that we can comprehensively address the social determinants of health related to TB, such as nutrition, alcohol abuse, smoking. This will be done within the framework of the multi-sectorial accountability for TB, which builds on the health in all policies. Distinguished ladies and gentlemen, I'm therefore directing staff in my ministry to work with all stakeholders in ensuring that we implement measures to prevent TB, increase the number of patients diagnosed with TB, and ensure they are started on anti-treatment immediately. In doing so, we'll be cutting further transmission of TB in our communities, which ultimately leads to the eradication of TB in Zambia. To catalyze these efforts, I wish to direct all stakeholders to raise awareness and to demystify the cultural norms about TB. I encourage all employers to establish workplace interventions that include providing opportunities to have regular screening, not only for TB, but also for blood pressure, diabetes, and HIV. Ladies and gentlemen, I wish to recognize and pay tribute to our partners involved in the fight against TB. These include the World Health Organization, the Global Fund Against AIDS and TB and Malaria, the United States government through the United States Agency for International Development, USAID, and Centers for Disease Control and Prevention, CDC, and indeed the World Bank, just to mention but a few. Ladies and gentlemen, I also want to recognize the services provided by the Churches Health Association of Zambia, CHAZ, and all other implementing partners, the civil society organizations and community-based organizations, for their relentless and sustained fight against TB. Ladies and gentlemen, allow me to express my sincere appreciation to Dr. Teresa Kaseva, the director of the Global TB Program at the World Health Organization in Geneva, for choosing and finding time to join our World TB Day commemoration. Dr. Kaseva and all international stakeholders, Zambia is determined to end TB by 2030. For us to achieve this goal, we need your continued support. Your participation today has helped us in raising awareness about TB. And once again, I really want to thank you for the enormous support that we have received from WHO in the past. We greatly appreciate this invaluable support. And I hope that we'll one day meet soon, Dr. Teresa. It will really be my pleasure. Ladies and gentlemen, I now declare the World TB Day commemoration officially launched. I thank you all and may God bless you.
To determine that we are ending the TB epidemic by 2030 in Zambia. Please, another round of applause. Thank you so much, Honorable Minister, for that speech and encouragement going forward. Now, is it my pleasure to call Dr. Patrick Lungu, our National TB and Leprosy Program Manager, to give a vote of thanks.
Thank you very much, Master of Ceremony. I would like just to indicate that I ride on the protocol earlier shared, but I would like just to recognize the presence of the Honorable Minister, our permanent secretaries, in charge of technical services. I would also want to recognize Dr. Kasieva, the Director of Global TB at WHO Geneva. I also recognize the WR for Zambia. Equally, I recognize the USAID mission, Ms. Sherry Stumblas. Ladies and gentlemen, I recognize all of you. On behalf of the TB program, I would like just to express our profound gratitude to the Honorable Minister for finding time to commemorate the World TB Day with us. Not only has she been with us today, but she was also with us in Quito, where we are launching the active case finding for which will be implemented countrywide so that we can achieve the UNGA target. Honorable Minister, we greatly appreciate your strong leadership and your determination to eliminate TB in Zambia. To all our stakeholders joined us remotely and those at joined in country, we express equally our profound gratitude to all of you. Lastly, we say thank you to everyone, and to just indicate that Zambia is certainly in the safe hands. We have the strong leadership from the political leadership, our permanent secretaries, and equally at technical level for us to achieve TB elimination come 2030. With that, I thank all of you and wishing you all the very best.
Thank you so much, Dr. Patrick Lungu, for those words. Ladies and gentlemen, now we are getting closer to the end of the program. So before we end, I would like that we stand so that we have a closing national anthem. I request Mrs. Winnie Mwanza to come and lead us in this national anthem.
Stand and sing of Zambia, proud and free, land of work and joy in unity, victors in the struggle for their rights. We've won freedom's fight, oh, one, strong and free. Praise be to God.
Praise be, praise be.
It's our great nation.
Zambia, Zambia.
Free men we stand under the flag of our land. Zambia is all one, strong and free.
Thank you so much. We can sit down. I, as the master of ceremony, now I would like to thank the Honorable Minister for continuing showing strategic and guidance to end TB, but also not forgetting our permanent secretary, but also all of you distinguished guests in Zambia, but also those of you who joined us outside Zambia. This marks the end of the World TB Day program today, but mind you, the World TB Day activities continue, so we should not stop today. I thank you so much and have a blessed day. Thank you.